Lead Exposure Control Program. The purpose of this program is to ensure that potential lead exposure hazards within our facility are identified, evaluated, and controlled according to 29 CFR 1926.62. The primary exposure to lead for Plaas Incorporated employees occurs when working with lead-coated piping. When abrasive blasting takes place on a job site, finely fractured particles of the material being removed from the pipes, lead paint for example, may create health risks for workers. Scope. This program applies to all construction work where an employee may be occupationally exposed to lead. Construction work is defined as work for construction, alteration, and/or repair, including painting and decorating. It includes but not is limited to the following: demolition or salvage of structures where lead or material containing lead are present, removal or encapsulation of materials containing lead, new construction or alteration, repair, or renovation of structures, substrates, or portions thereof that contain lead or materials containing lead, installation of products containing lead, lead contamination, emergency cleanup, transportation, disposal, storage, and containment of lead or materials containing lead on the site or location at which construction activities are performed, and maintenance operations associated with the construction activities listed above. This program shall be submitted upon request to any affected employee or authorized employee representative to the Assistant Secretary and the Director, and shall be available at the worksite for examination and copying by the Assistant Secretary and the Director. This program will be revised and updated at least every 6 months to reflect the current status of the program. Permissible exposure limit. Plaas Incorporated shall assure that no employee is exposed to lead at concentrations greater than 50 micrograms per cubic meter of air, 50 UG/M3, averaged over an 8-hour period. If an employee is exposed to lead for more than 8 hours in any workday, the employee's allowable exposure as a time-weighted average, TWA, for that day shall be reduced according to the following formula. Allowable employee exposure, IN UG/M3, equals 400 divided by hours worked in the day. When respirators are used to limit exposure, employee exposure may be considered to be at a level provided by the protection factor of the respirator for those periods the respirator is worn. Those periods may be averaged with exposure levels during periods when respirators are not worn to determine the employee's daily TWA exposure. Exposure assessment. Each job site that Plaas Incorporated employees work on will differ. Therefore, to determine if lead is present at a specific work site, the site foreman will communicate and work with the contract employer, if possible, to determine that if there is potential of lead exposure to an employee based on the work being performed. For the purposes of this program, employee exposure is that exposure which would occur if the employee were not using a respirator. If it is determined that monitoring is required under this program, Plaas Incorporated shall collect personal samples representative of a full shift, including at least one sample for each job classification and work area, either for each shift or for the shift with the highest exposure level. Full shift personnel samples shall be representative of the monitored employee's regular daily exposure to lead. Protection of employees during assessment of exposure. With respect to the lead-related tasks listed above where lead is present, until Plaas Incorporated performs an employee exposure assessment and documents that the employee performing any of the listed tasks is not exposed above the PEL, we shall treat the employee as if the employee were exposed above the PEL and not in excess of 10 times the PEL. Employee protective measures must then be implemented. The tasks covered by this requirement are where lead-containing coatings or paint are present, for example, pipes; manual demolition of structures, example, drywall; manual scraping, manual sanding, heat gun applications, and power tool cleaning with dust collection systems; spray painting with lead paint. In addition to the above tasks, when Plaas Incorporated has any reason to believe that an employee performing other tasks may be exposed to lead in excess of the PEL, we will also treat the employee as if he or she were exposed above the PEL and will implement protective measures. The protective measures will remain in effect until the employee exposure assessment is conducted and is documented that the employee's lead exposure is not above the PEL. When lead is present, until Plaas Incorporated performs an employee exposure assessment and documents that the employee performing any of the tasks listed below is not exposed in excess of 500 UG/M3, we shall treat the employees as if the employee were exposed to lead in excess of 500 UG/M3 and shall implement employee protective measures as prescribed later in this program. Whenever it is established that the employee is exposed to levels of lead below 500 UG/M3, Plaas Incorporated will provide the exposed employees with the appropriate respirator prescribed for use as such at lower exposures in accordance with Table 1 of this program. The tasks covered by this requirement are using lead-containing mortar, lead burning, where lead-containing coatings or paint are present, example pipes, rivet busting, power tool cleaning without dust collection systems, cleanup activities where dry expendable abrasives are used, abrasive blasting enclosure movement and removal. With respect to the task list below where lead is present and until Plaas Incorporated performs an employee exposure assessment and documents that the employee performing any of the listed tasks is not exposed to lead in excess of 2500 UG/M3, 50 times PEL, we will treat the employee as if the employee were exposed to lead in excess of 2500 UG/M3 and shall implement employee protective measures. When it is established that the employee is exposed to levels of lead below 2500 UG/M3, Plaas Incorporated will provide the exposed employee with the appropriate respirator prescribed for use at such lower exposures in accordance with Table 1 of this section. In turn, protection is required where lead-containing coatings or paint are present on structures when performing abrasive blasting, welding, cutting, torch burning. Until Plaas Incorporated performs an employee exposure assessment and determines actual employee exposure, Plaas Incorporated will provide to employees performing the tasks described above with in-term protection as follows: appropriate respiratory protection, appropriate personal protective clothing and equipment, change areas, hand washing facilities, biological monitoring to consist of blood sampling and analysis for lead and zinc protoporphyrin levels, lead training, hazard communication training, and training regarding use of respirators. Base of initial determination. Plaas Incorporated will monitor employees when exposed to lead and shall base initial determinations on the employee exposure monitoring results and any of the following relevant considerations: any information, observations, or calculations which would indicate employee exposure to lead, any previous measurements of airborne lead, any employee complaints of symptoms which may be attributable to exposure to lead. Monitoring for the initial determination, where performed, may be limited to a representative sample of the exposed employees whom we believe are exposed to the greatest airborne concentrations of lead in the workplace. If Plaas Incorporated obtains objective data which demonstrates that a particular product or material containing lead or a specific process, operation, or activity involving lead cannot result in employee exposure to lead at or above the action level during processing, use, or handling, we may rely upon such data instead of implementing initial monitoring. If objective data is relied upon, an accurate record documenting the nature and relevancy of the data will be maintained. Positive initial determination and initial monitoring. Where a determination shows the possibility of any employee exposure at or above the action level, Plaas Incorporated will conduct monitoring, which is representative of the exposure for each employee in the workplace who is exposed to lead. Negative initial determination. Where a determination is made that no employee is exposed to airborne concentrations of lead at or above the action level, Plaas Incorporated will make a written record of such a determination. The record shall include the date of determination, location within the worksite, and the name and social security number of each employee monitored. Frequency. If the initial determination reveals employee exposure to be below the action level, further exposure determination need not be repeated except as otherwise provided in the lead standard. If the initial determination or subsequent determination reveals employee exposure to be at or above the action level, but at or below the PEL, Plaas Incorporated shall perform monitoring at least every 6 months. Monitoring shall continue at the required frequency until at least 2 consecutive measurements taken at least 7 days apart are below the action level, at which time the employer may discontinue monitoring for that employee. If the initial determination reveals that employee exposure is above the PEL, Plaas Incorporated shall perform monitoring quarterly. Monitoring should continue at the required frequency until at least 2 consecutive measurements taken at least 9 days apart are at or below the PEL, but at or below the action level, at which time monitoring shall be repeated for that employee. Monitoring shall continue at the required frequency until at least 2 consecutive measurements taken at least 7 days apart are below the action level, at which time monitoring may discontinue for that employee. Additional exposure assessments. Whenever there has been a change of equipment, process, control, personnel, or a new task has been initiated that may result in additional employees being exposed to lead or above the action level, or may result in employees already exposed at or above the action level being exposed above the PEL, additional monitoring should be conducted. Employee notification. Within 5 working days after completion of an exposure assessment, the safety manager will notify each employee in writing of the results that represent that employee's exposure. Whenever the results indicate that the representative employee's exposure without regard to respirators is at or above the PEL, a statement that the employee's exposure was at or above that level, and a description of the corrective action taken or to be taken to reduce exposure to below that level will be conducted in the written notice. Accuracy of measurement. A method of monitoring and analysis which has an accuracy to a confidence level of 95% of not less than plus or minus 25% for airborne concentrations of lead equal to or greater than 30 Ug/M3 should be used during measurements. Engineering and work practice controls. Action should be taken to reduce exposure to or below the permissible exposure. If engineering and work practice controls do not reduce exposure to acceptable limits, the employer may supplement with respirators. If such controls are not feasible, the employer may demonstrate and document the reasons. Engineering and work practice controls include administrative controls, will be implemented where practical and feasible to reduce and maintain employee exposure to lead to or below the permissible exposure limit. Whenever all feasible engineering and work practice controls are not sufficient to reduce employee exposure to or below the permissible exposure limit, they will be used to reduce employee exposure to the lowest feasible level and shall be supplemented by the use of respiratory protection. On multi-contractor sites, Plaas Incorporated will inform affected employees of potential exposure to lead if it is found to be present. The site foreman or the safety manager to evaluate job sites, materials, and equipment will conduct frequent and regular inspections. Respiratory protection. Plaas Incorporated has developed a written respiratory protection program in accordance with 29 CFR 1910.134. Because exposure to lead while performing abrasive blasting on pipe is infrequent and limited in duration, respirators will be used to help control exposure. Plaas Incorporated employees must wear respirators. Periods when an employer's exposure to lead exceeds the PEL. Work operations for which engineering and work practices are not sufficient to reduce employees' exposure to or below the PEL. Periods where an employee requests a respirator. Periods when respirators are required to provide interim protection of employees while they perform the operations specified on pages 3 and 4 of this program. Respirator selection. The appropriate respirator or combination of respirators will be selected from Table 1. Plaas Incorporated will provide a powered air purifying respirator when an employee chooses to use such a respirator, and it will provide adequate protection to the employee. Protective work clothing and equipment. Where an employee is exposed to lead above the PEL without regard to the use of respirators, where employees are exposed to lead compounds which may cause skin or eye irritation, example lead arsenate, lead acid, and as interim protection for employees performing specific tasks, protective work clothing and equipment will be provided for employees. Site foreman will be responsible for ensuring employees use appropriate protective work clothing and equipment that prevents contamination of the employee and the employee's garments. Examples of protective work clothing and equipment include, but are not limited to, the following: coveralls or similar full-body work clothing, gloves, hats, and shoes or disposable shoe coverlets, face shields, vented goggles, or other appropriate protective equipment which complies with 29 CFR 1910.133. Cleaning and replacement. Protective clothing and all other PPE will be provided in clean and dry condition at no cost to the employee. Plaas Incorporated will be responsible for the proper disposal of protective clothing and equipment to protect employees against lead exposure. Protective clothing and equipment will be repaired or replaced as needed to maintain their effectiveness. Contaminated protective clothing, which is to be cleaned, laundered, or disposed of, should be placed in a closed container in the change area, which prevents dispersion of lead outside the container. Any person who cleans or launders protective clothing or equipment shall be informed of the potentially harmful effects of exposure to lead. Containers of contaminated protective clothing and equipment will be labeled as follows. Caution. Clothing contaminated with lead, do not remove dust by blowing or shaking. Dispose of lead-contaminated water in accordance with applicable local, state, or federal regulations. Employees will not be allowed to remove lead from protective clothing or equipment by blowing, shaking, or any other means which disperses lead into the air. Housekeeping. All surfaces should be maintained as free as practical of accumulations of lead. Cleanup of floors or other surfaces where lead accumulates will, whenever possible, be cleaned or vacuumed, or other methods that minimize the likelihood of lead becoming airborne. Shoveling, dry or wet sweeping, and brushing may be used only where vacuuming or other equally effective methods have been tried and found not to be effective. Where vacuuming methods are selected, the vacuums shall be equipped with HEPA filters and used and emptied in a manner which minimizes the re-entry of lead into the workplace. Compressed air shall not be used to remove lead from any surface unless the compressed air is used in conjunction with a ventilation system designed to capture the airborne dust created by the compressed air. Hygiene facilities and practices. In areas where employees are exposed to lead above the PEL without regard to the use of respirators, food, beverages, and tobacco products are not allowed. Cosmetics should not be applied in these areas. Change areas. Clean change areas will be provided for employees whose airborne exposure to lead is above the PEL without regard to the use of respirators. Change areas will be equipped with separate storage facilities for protective work clothing and equipment for street clothes which prevent cross-contamination. Employees may not leave the workplace wearing any protective clothing or equipment that is required to be worn during the work shift. Shower facilities will be provided where feasible for use by employees whose airborne exposure to lead is above the PEL. Where shower facilities are available, employees should shower at the end of the work shift. Eating facilities. Lunchroom facilities or eating areas for employees whose airborne exposure to lead is above the PEL, without regard to the use of respirators, will be provided. Lunchroom facilities or eating areas will be kept as free as practical from lead contamination and will be readily accessible to employees where feasible. Employees should wash their hands and face prior to eating, drinking, smoking, or applying cosmetics. Lunchroom facilities or eating areas should not be entered with protective work clothing or equipment unless surface lead dust has been removed by vacuuming, downdraft booth, or other cleaning method that limits dispersion of lead dust. Hand washing facilities. Hand washing facilities will be provided for use by employees exposed to lead. Where showers are not provided, employees should wash their hands and face at the end of their work shift. Medical surveillance. Medical surveillance will be made available to employees occupationally exposed on any day to lead at or above the action level. Initial medical surveillance consists of biological monitoring in the form of blood sampling and analysis for lead and zinc protoporphyrin levels. All medical examinations and procedures must be performed by or under the supervision of a licensed physician. Medical surveillance, including multiple physician review, will be made available to employees exposed to lead above the action level without cost to employees and at a reasonable time and place. Biological monitoring. Blood, lead, and ZPP level sampling and analysis. Biological monitoring in the form of blood sampling and analysis for lead and zinc protoporphyrin levels will be made available to each employee covered under the medical surveillance program on the following schedule. For each employee, at least every 2 months for the first 6 months and every 6 months thereafter. For each employee whose last blood sampling and analysis indicate a blood level at or above 40 UG/DL, at least every 2 months. This frequency shall continue until 2 consecutive blood samples and analysis indicate a blood level below 40 UG/DL. And for each employee who is removed from exposure to lead due to an elevated blood lead level, at least monthly during the removal period. Follow-up sampling test. Whenever the results of a blood lead level test indicate that an employee's blood lead level exceeds the numerical criterion for medical removal, a second follow-up blood sampling should be provided to test within 2 weeks after the employer received the result of the first blood sampling test. Accuracy of blood lead level sampling and analysis. Blood lead level sampling and analysis provided must have an accuracy to the confidence level of 95%, within plus or minus 15% or 6 UG/DL, whichever is greater, and will be conducted by a laboratory approved by OSHA. Employee notification. Within 5 working days after the receipt of biological monitoring results, the safety manager will notify each employee in writing of his or her lead level, and each employee whose blood lead level exceeds 40 UG/DL will be informed that the standard requires temporary medical removal within medical removal protection benefits when an employee's blood lead level exceeds the numerical criterion for medical removal. Medical examinations and consultations. Frequency. The employer shall make available medical examinations and consultations to each employee covered under this program on the following schedule. At least annually for each employee for whom a blood sampling test conducted at any time during the preceding 12 months indicated a blood lead level at or above 40 UG/DL. As soon as possible upon notification by an employee either that the employee has developed signs or symptoms commonly associated with lead intoxication, that the employee desires medical advice concerning the effects of current or past exposure to lead on the employee's ability to procreate a healthy child, that the employee is pregnant, or that the employee has demonstrated difficulty in breathing during a respirator fitting test or during use. As a medically appropriate for each employee either removed from exposure to lead due to the risk of sustaining material impairment to health or otherwise limited pursuant to a final medical determination. The content of medical examination shall be determined by the examining physician, and if requested by the employee shall include pregnancy testing or laboratory evaluation of male fertility. Medical examination shall include the following elements: a detailed work history and a medical history with particular attention to past lead exposure, occupational and non-occupational, personal habits, smoking and hygiene, and past gastrointestinal, hematologic, renal, cardiovascular, reproductive, and neurological problems. A thorough physical examination with particular attention to teeth and gums, hematological, gastrointestinal, renal, cardiovascular, and neurological systems. Pulmonary status should be evaluated if respiratory protection will be used. A blood pressure measurement. A blood sample and analysis which determines blood lead level, hemoglobin and hematocrit determinations, red cell indices, and examination of peripheral smear morphology. Zinc protofortin. Blood urea nitrogen and serum creatinine. A routine urinalysis with microscopic examination. Any laboratory or other test relevant to lead exposure which the examining physician deems necessary by sound medical practice. Multiple physician review mechanism. If Plaas Incorporated selects the initial physician who conducts any medical examination or consultation provided to an employee under this section, the employee may designate a second physician to review any findings, determinations, or recommendations of the initial physician, to conduct such examinations, consultations, and laboratory tests as a second physician deems necessary to facilitate this review. Employees shall be promptly notified of the right to seek a second medical opinion after each occasion that an initial physician conducts a medical examination or consultation. Plaas Incorporated may condition its participation in and payment for the multiple physician review mechanism upon the employee doing the following: within 15 days after receipt of the foregoing notification or receipt of the initial physician's written opinion, whichever is later. The employee informing Plaas Incorporated that he or she intends to seek a second medical opinion, and the employee initiating steps to make an appointment with the second physician. If the findings, determinations, or recommendations of the second physician differ from those of the initial physician, then Plaas Incorporated and the employee shall assure that efforts are made for the two physicians to resolve any disagreement. If the two physicians have been unable to quickly resolve their disagreement, then the employer and the employee, through their respective physicians, shall designate a third physician to review any findings, determinations, or recommendations of the prior physician, to conduct such examinations, consultations, laboratory tests, and discussions with the prior physicians as the third physician deems necessary to resolve the disagreement of the prior physicians. Plaas Incorporated shall act consistent with the findings, determinations, and recommendations of the third physician unless an agreement is reached which is otherwise consistent with the recommendations of at least one of the three physicians. Information provided to examining and consulting physicians. Physicians conducting a medical examination or consultation under this program will be provided with the following information: a copy of this regulation for lead, including all appendices, a description of the affected employee's duties as they relate to the employee's exposure, the employee's exposure level or anticipated exposure level to lead and to any other toxic substance if applicable, a description of any personal protective equipment used or to be used, prior blood lead determinations, and all prior written medical opinions concerning the employee in the employer's possession or control. The foregoing information will be provided to a second or third physician conducting a medical examination or consultation under this program upon request either by the second or third physician or by the employee. Written medical opinions. A copy of a written medical opinion from each examining or consulting physician should be provided to the employee and should contain only the following information: the physician's opinion as to whether the employee has any detected medical condition which would place the employee at an increased risk of material impairment of the employee's health from exposure to lead, any recommended special protective measures to be provided to the employee or limitations to be placed upon the employee's exposure to lead, Any recommended limitation upon the employee's use of respirators, including a determination of whether the employee can wear a powered air purifying respirator if the physician determines that the employee cannot wear a negative pressure respirator, and the results of the blood lead determinations. Each examining and consulting physician will be instructed to not reveal either in the written opinion or orally or in any other means of communication with the employer findings including laboratory results or diagnosis unrelated to the employee's occupational exposure to lead. Advise the employee of any medical condition, occupational or non-occupational, which dictates further medical examination or treatment. Medical removal protection. An employee will be removed from work if he or she has an exposure to lead at or above the action level on each occasion that a periodic and follow-up blood sampling test conducted pursuant to this section indicate that the employee's blood lead level is at or below 50 Ug/dl. In addition, an employee will be removed from work if he or she has an exposure to lead at or above the action level on each occasion that a final medical determination results in the medical finding, determination, or an opinion that the employee has a detected medical condition which places the employee at increased risk of material impairment to health from exposure to lead. Where a final medical determination results in any recommended special protective measures for an employee or limitation to an employee's exposure to lead, Plaas Incorporated will implement and act consistent with the recommendation. Provision of medical removal protection benefits. Plaas Incorporated will provide an employee up to 18 months of medical removal protection benefits on each occasion that an employee is removed from exposure to lead or otherwise limited pursuant to this program. Workers' compensation claims. If a removed employee files a claim for workers' compensation payments for a lead-related disability, then Plaas Incorporated shall continue to provide medical removal protection benefits pending disposition of the claim. To the extent that an award is made to the employee for earnings lost during the period of removal, Plaas Incorporated's medical removal protection obligation shall be reduced by such amount. Training. Plaas Incorporated will communicate information concerning lead hazards according to the requirements of OSHA's Hazard Communication Standard for the Construction Industry, 29 CFR 1926.59. Training will include but not be limited to the requirements concerning warning signs and labels, material safety data sheets, and employee information and training. In addition, the following requirements must also be met. For all employees who are subject to exposure to lead at or above the action level on any day, or who are subject to exposure to lead compounds which may cause skin or eye irritation, example, lead, arsenate, leadicide, Plaas Incorporated will provide a training program and assure employee participation. Plaas Incorporated will provide the training program at least annually for each employee who is subject to lead exposure at or above the action level on any day. Training program. Plaas employees shall be informed of appendices A and B of this regulation. All affected employees are required to attend initial and annual training programs. All employees shall be informed of the specific nature of the operations which could result in exposure to lead above the action level, the purpose, proper selection, fitting, use, and limitation of respirators, engineering controls, purpose and a description of the medical surveillance program and the medical removal program. Each employee should be trained in the following: the content of the lead standard, 1926.62, and its appendices, the specific nature of the operations which could result in exposure to lead above the action level, the purpose, proper selection, fitting, use, and limitations of respirators, the purpose and a description of the medical surveillance program, and the medical removal protection program, including information concerning the adverse health effects associated with excessive exposure to lead, with a particular attention to the adverse reproductive effects on both males and females, and hazards to the fetus and additional precautions for employees who are pregnant. The engineering controls and work practices associated with the employer's job assignment, including training of employees to follow relevant good work practices, described in Appendix B of this section. The contents of any compliance plan in effect. Instructions to employees that chelating agencies should not routinely be used to remove lead from their bodies and should not be used at all except under the direction of a licensed physician, and the employee's right of access to records under 29 CFR 1910.20. Access to information and training material. A copy of the lead standard and its appendices will be made readily available to all employees. Upon request, all materials relating to the employee information and training program will be provided to affected employees and their designated representatives and to the Assistant Secretary and the Director. Signs. Plaas Incorporated will post the following warning signs in each area where employee exposure to lead is above the PEL. Warning: lead work area, poison, no smoking or eating. Such signs must be illuminated and cleaned as necessary so that the legend is readily visible. Record keeping. Accurate records of all monitoring and other data used in conducting employee exposure assessment will be established and maintained. Exposure monitoring records shall include the date, number, duration, location, and results of each of the samples taken, including a description of the sampling procedure used to determine representative employee exposure where applicable, a description of the sampling and analytical methods used and evidence of their accuracy, the type of respiratory protective devices worn, if any, name, social security number, and job classification of the employee monitored, and of all the other employees whose exposure the measurement is intended to represent, the environmental variables that could affect the measurement of employee exposure. Monitoring records and other exposure assessment records will be maintained in accordance with provisions of 29 CFR 1910.20. Medical surveillance. Accurate records for each employee subject to medical surveillance will be maintained as required by this program. This record shall include the name, social security number, and description of the duties of the employee, a copy of the physician's written opinions, results of any airborne exposure monitoring done on or for that employee and provided to the physician, and any employee medical complaints related to exposure to lead. Plaas Incorporated shall keep or assure that the examining physician keeps the following medical records: a copy of the medical examination results including medical and work history, a description of the laboratory procedures, and a copy of any standards or guidelines used to interpret the test results or references to that information, a copy of the results of biological monitoring. Medical removals. Accurate records for each employee removed from current exposure to lead should be established and maintained. Each record shall include the name and social security number of the employee, the date of each occasion that the employee was removed from current exposure to lead, as well as the corresponding date at which the employee was returned to his or her former job status, a brief explanation of how each removal was or is being accomplished, a statement with respect to each removal indicating whether or not the reason for the removal was an elevated blood lead level. Each medical removal record should be maintained for at least the duration of an employee's employment. Plaas Incorporated will make available upon request all records required to be maintained by this program to effective employees, former employees, and their designated representatives, and to the Assistant Secretary and to the Director of Examination and Copying. Observation of monitoring. Plaas Incorporated will provide affected employees or their designated representatives an opportunity to observe any monitoring of employees' exposure to lead. Whenever observation of the monitoring of employee exposure to lead requires entry into an area where the use of respirators, protective clothing, and/or equipment is required, Plaas Incorporated will provide the observer with and assure the use of such respirators, clothing, and equipment, and shall require the observer to comply with all other applicable safety and health procedures. Without interfering with the monitoring, observers shall be entitled to receive an explanation of the measurement procedures, observe all steps related to the monitoring of lead performed at the place of exposure, record the results obtained, or receive copies of the results when returned by the laboratory. Lead training, comprehensive written exam. Number 1, what is the most common source of exposure to lead? Airborne exposure. Number 2, what is OSHA's definition of lead-based paint? Any amount of lead triggers the OSHA standard. Number 3, what activities produce airborne lead dust, fumes, or mist? Welding, cutting, burning, sandblasting. Number 4, what are the 2 routes or pathways for lead to enter the body? Inhalation, ingestion. Number 5, what are the health effects of lead if it is allowed to accumulate in the body? Damage to kidney, central nervous system, reproductive system, gastrointestinal system. Number 6, what are some early warning signs and symptoms of overexposure to lead? Headaches, loss of appetite, dizziness, metallic taste in the mouth, muscle joint pain, nausea, insomnia, tremors. Number 7, what is OSHA permissible exposure limit, PEL, for lead? Over what length of time should exposure be evaluated? PEL is 50 micrograms / M3 over 8-hour work shift. Number 8, what is the OSHA acceptable method for removing lead dust from work clothing? Laundering, weekly, daily based on exposure. Shaking or blowing clothing is prohibited Use vacuuming or downdraft booth. Number 9. What control measures does OSHA require an employer to implement before selecting the respiratory protection? Engineering and work practice controls to reduce exposure below the PEL. Controls include ventilation, vacuum systems, alternative removal methods, housekeeping procedures, hygiene facilities, protective clothing. Number 10. What medical test is a good measure of lead absorption in the body? Blood, lead, and ZPP analysis. Number 11. Where should lead abatement workers store their street clothes? In storage lockers separate from street clothes to prevent cross-contamination. Number 12. What are the requirements for food, beverage, cigarettes, etc. at lead removal projects? Lunchroom facilities must be provided maintained as free as possible from lead contamination. Employees must be prohibited from entering area without ensuring clothing is cleaned prior to entry. Number 13. What is the acceptable blood lead level established by OSHA? Less than 50 micrograms/dl. 14. When does OSHA require a full medical examination by a physician? Annually for employees whose blood level was 40 micrograms/dl or greater. During the preceding 12 months after employee notification of symptoms, wants medical advice on reproductive ability, pregnancy, or difficulty breathing, during a respirator fit test, as medically appropriate for medical removal cases. Number 15. At what blood level does OSHA require an employer to remove an employee from the lead work area? 50 micrograms/dl. 16. What are the typical exposure levels, airborne contaminants, to lead during abrasive blasting operations? 1352 to 58,700 micrograms/M3. 17. If using an air purifying respirator to protect yourself from lead dust, what type of filter is required? What color is the filter? HEPA, pink color. 18. What are chelating agents? What are they used for? Who is allowed to administer them? Used to make lead soluble in H2O so it can be removed by the body. Chelating agents are used in cases of severe lead poisoning only under the direction of a physician. Number 19. What must a lead abatement worker do each time an air purifying respirator is worn into a work area? Positive and negative pressure fit check, respirator inspection.